Afternoon. We're just waiting for everybody to come through the lobby. We will start at 5 past the hour. Thank you. There we go. Welcome everybody that joined the session this afternoon. Let me just firstly start by saying that I trust that we have all arrived at this meeting today with the mindset to find solutions and to also acknowledge the challenges that have resulted in a system go live challenge. I think firstly also important for us to recognize that there have been challenges during the rollout phase, and we acknowledge the inconvenience that this has caused to everybody concerned. I can also state that our teams have been working diligently to address these issues, and we remain committed to ensuring a smooth user experience for everyone. However, in saying that, it's also important for us to reflect on where compliance with the provided guidelines might have prevented some of the bottlenecks. And for us to move forward effectively, it is then critical that we allow all users to follow the system guidelines and account verification steps as outlined. So with that being said, I think also the format of today's discussion, it will be a discussion-based engagement. So we will start just taking you through and unpacking with you some of the things that we've seen, sharing with you some of the, I want to say mitigation steps that we have taken. But then also after the presentation session is finished, we want to then enable all of the microphones so that we can start a dialogue and talk about some of the challenges and talk about some of the potential solutions. So I think, Ntokozo, if you can maybe permit me then just to share my screen so that we can get straight into it. Colleagues, just permit a moment whilst it loads. Ntokozo, if you can just confirm as soon as it's loaded and you can see it on your side.
It's visible. Thanks, Kristalina.
All right, great stuff. Thank you. All right, great. So I think first things first, just covering some background. We have done quite a bit in preparation for the go live. We have done some testing with our focus groups, some internal testing, and I think through that process, there were also some enhancements and tweaks that we attended to. And as we've shared previously, there certainly was an expectation that from a master data perspective, we will need to also address some of the gaps. And I think we'll go through that a little bit today. But what we have noted in terms of the support log tickets that have been coming through, we have, I think, just bucketed them largely. Looking at the trends, there are some things from a SAHPRA perspective where we can take you through the user log breakdown as we then bucket and group these things to triage them and address issues that are common across multiple users. There are some things that sits on our to-do list, on our mitigation log. But then there are also a few things that we need applicants to assist us with, which are user-driven activities that requires resolution. So we also want to just then reflect on the process for this week, being the 7th through to the 11th. And as I said, then open up the dialogue so that we can discuss items which we have not addressed in any of the slides or mentioned in any of the themes or topics that we'll cover. So I think first thing, what we anticipated, and we did share previously some data, legacy data specifically, also trying to identify some of the missing sequences or missing submissions. And this was an exercise that through HPA we conducted quite early on in the year. Imperative then to have received that feedback in order for us to then also close some of the legacy data gaps. So we have identified that there may be potential missing sequences. And I think a lot of applicants have assisted with that process. Where through HPA, Pratiba led that for us, where we then started receiving those resubmissions and those sequences, and we were able to close the data gaps quite nicely. We also were expecting some, I want to say, misses in terms of the site master files, your APIMFs, etc., etc. I mean, these registers that we have brought through from the units, we have gone through a process to sanitize them, normalize the data, and this has been ongoing since October of last year. However, it is something where we acknowledge that we will still need to go through a process of refinement, and we also then count on our applicants to provide us that steerage where they pick up something is missing or needs updating or does not reflect the current value that should be in a specific field. For INN and APIs, we have used the lookups, and I think you will note as well that there is a search that runs, that pulls through retrieval augmented generative AI tool to also then pull in the CEP and CPQ information, and also reference the APIMF list, which is maintained by SAHPRA. But again, we are mindful of the fact that there may be some gaps, and we'll talk about how we address those shortly. And I think the other thing which we were also expecting was feedback on the calculation of the fees, and more especially around the calculation for variations and how we then address that, and also maintain and update that fee calculation schedule, which is linked to a specific variation code. What we, however, did receive that complicated the process quite a bit is during account registration, we saw that the organizations, the legal entities that registered their accounts started creating more and more user accounts for the same legal entity. It also, we had duplication in terms of the same CIPC number used in a lot of those accounts. Some cases, the information was incorrectly captured. We had license numbers captured instead of the CIPC number. Also, the formatting for the CIPC wasn't always correct. We sometimes had spaces in there. And unfortunately, this directly impacts the system's ability to link the list of applications, submissions, and sequences to a unique identifier, i.e. the legal entity that is responsible for the IP and the product connected through their CIPC. To further compound matters, we also had a large number of accounts that were created. Users filled in their application form, filled in their details, logged their account, but failed to complete the account verification. And certainly, as many of us know, when you, I mean, all of us that has done some online shopping, you do need to complete that account verification in order for that account to be active and for you to be able to transact. And we had the same instance here. We had multiple attempts to resend links, but because that initial first step was missed, it just kept clogging up the mail servers on our side as well as the applicant side. So these two components affected the onboarding of your legacy data, as of course it couldn't find matches and it was looking to try and match things across multiple accounts. So we had import errors. As a result, that affected directly your ability to find your data, looking for your applications, not finding them in the dashboard, and you could not therefore submit things like your variations or renewals requests. We also further have picked up where incorrect or old proof of payments have been uploaded as the proof of payment, where either the payment reference number or the value, some of these payments dating back 2022, 2023, were uploaded, and unfortunately those paid values do not match the current fee gazette. And that has also resulted in us having to send back or dispute a lot of those proof of payments or payments. And I suspect that in the ECTD, we then have that same proof of payment attached there as well, which means that now we will further have to, if that application comes through, again, send now an administrative or technical screening query. The other challenge that we also have been experiencing is that either incorrect FTP details have been maintained on the organization's account. And the direct result of that is either incorrect or not completed at all, is that when the portal writes the automated trigger file, it does not know where to send that file to. So even if you have in the ECTD dropped your ECTD on the FTP folder as you normally would, the trigger file would never find the right destination because it doesn't know where to write the file to. Or if there is no details at all, it cannot write the trigger file, and there is then a trigger file failure. So really, a few things I think that really just compounded issues around the account maintenance and how we manage the detail and the data as it relates then to our organizational accounts. And hopefully also the way that I've explained it makes it clear in terms of the linkages that resides within a lot of these metadata fields that are drivers for these critical interfaces and for things to actually update and link through to the appropriate organization accounts. So then just to go through what we've seen on the support log, things that we've got on our list to attend to and to address is that the feedback around the ATC class, it's to be set at level 2. Currently, it's set at level 5, and this will be addressed before close of business today. So thank you to the colleagues that have provided that feedback. At least this was a low-hanging fruit item for us that we can easily address. We also have to, as a result of the user account challenges, the multiple accounts or incorrect CIPC numbers that was populated, we now have to start a process to re-import sequences and submission data sets against then a consolidated, complete organizational account. But we can only start the re-import of the sequence and submission data once the accounts have been cleaned up. I also have to acknowledge and thank the applicants that have created only one account and have provided the correct information. These accounts have been mapped, data was imported, and we have had some successful submissions go through from the portal side into DocuBridge with the automated backstamps between systems and with automated also then sending through acknowledgement of positive submissions. The other aspect that we also have picked up on the support logs is the API lookup. A question around the requirements for fixed dose combination, how to load those different APIs. We'll touch on that very briefly now. There is also an enhancement that is underway where a lookup, as preferable, because we are still focused on data standardization and normalization and data cleansing, a lookup is preferable in terms of typing the INN or the API. If the system is not able to pick up a hit, then we then allow for an override function so that you can still type in the API and the INN. And this is then something that over the course of the next few months, we will continue to clean, ensure that we start building a very good reference structure around all of those APIs and INNs. And again, as I said, just with a focus to comply with the ISO IDMPs, we will also be engaging UMC and looking at various other data sources to make sure that our data structures then conform and they are very complete. I think the other elements that also came up a few times, and there were different master data elements actually that we saw that was given through in the support logs and the queries. Some of it had raised or flagged issues around site master file related information, where either the entity name or the organization's name has changed, and it's still reflected an old value on the reference list, where we have an incorrect SMF number that was reflected. We have some missing API manufacturers in the APIMF reference sheet. There was a question around variation codes, specifically these ones as they relate to biologicals variations, where we could not find those in the reference lists. Some other comments around dosage forms to be added or included, route of administration, etc. Now, the master data list that we've got here, it's not an exhaustive list. And obviously, we expect to get more feedback as we continue the rollout phases. And we will allow for others to be added. But the key thing for us was to also work on a master data amendment or correction request form. And I'll talk about that when we go through the plan of action for the rest of the week. So this is something that we will share, and specifically the way that we want to receive those requests or prompts, how to then send that to us so that we can make sure that receives a dedicated resource so that we can have very rapid turnaround times on updating the reference tables in order for you to progress them with your applications. We also have received, and thank you for the colleagues that have alerted us to this, where the baseline sequence calculation was set to reflect as 0001, which is incorrect because that should be the counter for initial submission, whereas baselines, according to our guidelines, set to start at 0000. And this has also now been addressed. Then I think the ask specifically around assistance that's required from our applicants, and I mean, I have explained this in a little bit of detail already, but we do need your assistance in terms of the correction of duplications of organizational accounts. But we also ask, please, that internally in your organizations, that there is a greater level of communication and coordination around who the account admin is and how we then invite users to that account so that we don't have users within one organization going to set up and create their own accounts. I think that for us is quite important, that that coordination is just done at an organization level. Also, please, for the admin users for the different organizations, kindly assist us by completing then all of the information that's required for the organization, Really key things for us is the correct information in the CIPC field, that it must be a CIPC number. We cannot link anything if you put a SAHPRA license number in there. And it also must conform with the CIPC nomenclature. Unfortunately, with some of the capturing, we noted that there were spaces that was left between the backslash. And even that space means that it's a value that we cannot read, that we cannot link, because it looks different to what we have on the master data set that needs to be pulled in. The FTP we've spoken about, very critical for us to have that details and the correct details to boot in order for us to trigger the trigger file, but also write it then to your specific folder once your applications have been submitted and you click on the Confirm FTP button. The other ask, and I think we suspect that part of the reason maybe for the multiple accounts under one legal entity could be that there is perhaps not clarity or that the guideline around account maintenance hasn't been consulted very intently. And as a result, we have seen multiple accounts instead of an organization account belonging to a CIPC, with then divisions or sites set up within that organization account. We'll touch on that, I think, also in the slides a little bit, just to remind and ground us again in terms of what is covered in the guideline for user accounts. We also please ask, when the users are invited to join an organization or join a divisional account, they must indeed complete the user registration form, do their submission, but very critical is that they wait for that verification link and they actually click on it to verify and confirm the account. Otherwise, we will continue to struggle to log on if that is not done. Access to applications, I think the applications that were previously submitted as ECTDs. And these obviously specifically the new ones that we saw April 2024, even the ones prior. For those, we have information and it was easy to pull those in from the DocuBridge system. Since we've started using the trigger files, we have adequate metadata that is now coming along with those submissions, and it allows us then to very easily map, reference, and have data in the relevant data fields. Unfortunately, for some of the applications where we haven't yet seen an ECTD submission come through, so a lot of those that were still in the e-submission format, there is quite a lot of data fields that needs to then be captured. If you want to now come and do a variation, or if you want to come and do a renewal, because that same data that we ask you to update in the legacy data section on your dashboard is the same data that you would have had to populate on the trigger file if we were still using the manual trigger file. And that is why we have to go through that exercise to update that specific application and application ID's data for that product, so that when the trigger file writes, the information is there, system can read it and then populate it on the automated trigger file section. And then just a note, we have also seen a number of support requests where users weren't able to access the portal. I think for users that is still using Microsoft Edge, please, if you can, just remind everybody in your organization, we are running the Google Chrome. And as such, when we want to access the SAHPRA portal, we have to open the Google Chrome web browser and then go to the SAHPRA portal link. Right, so I think this, just as an example, it's important for us to just note and explain how things look or what we're seeing in the system. So as we can see, there are multiple accounts that's been created, and this is why I'm saying it's so important for us to just have coordination around these things. As we note here, quite a number of these created in short succession of each other. And it does seem that there was a bit of a disconnect or a miscommunication between people in the organization. This again, just some of the multiple or duplicate accounts. This is just a screenshot from that list. As we've noted, we were able in this list to, where there is, as you can see, 2 registration numbers, we can then actually identify which is the main account and which is the one that's duplicate that needs to be deleted. So the ones that's red and green, we have managed to go through that exercise, actually go into each organization, try and see what can be done to also assist just with the cleanup. But there are some individual organizations, these are the ones in blue, where we will need to reach out on an individual basis and just request that you also provide guidance in terms of which we keep and which we can actually remove, so that we can remove those other accounts and then just request that the one account is used and all of the users that may be on the other just be re-added to the correct account. This is just a reminder of where that FTP information needs to be populated. So if it's left blank like that, the problem as described earlier. Also, just to remind and anchor everybody around what that CC email address was for. And that came out during our focus group testing discussions, where we were sensitized to the fact that sometimes organizations would use a mailbox or a group mail that needed to be copied or CC'd or receive all of the communication. And I mean, even from our side, we use that mechanism and approach to ensure that if somebody is on leave or not available, that if you add your group email address in this area, every notification that comes through the portal actually goes to that CC mail address. So please do not put SAHPRA email address in there. Otherwise, we will get all the mails that's actually intended for your mailbox. This is your own internal CC email address. And even if it means it's just one individual that needs to get everything and see everything, then that's where you add the details. Otherwise, it would then be your group email address, which receives then basically a copy of all of the notification and correspondence. So what we have, and I think maybe also just to remind everybody around just the setup of the organization. So we've got, as you created your organization, we've got organizations detail, user management. We also have this little section here for subdivisions. And this is the area that I was talking to. So if there is different focus areas, if your site or your division or your functional structure requires you to have different people then sitting in different groups for you to manage workflow or activities, this is the area that you need to go and set that up. So you would basically select subdivision. You will then enter the name of whatever division or site or activity area you need to load, whether that is so-and-so vaccines or so-and-so OTC. This is where that would get set up. And once you've set up all of your sites, your divisions, etc., and you click add, you would then see this screen, which is then, and this has been grayed out, obviously. You would basically have this view where you can then, here on the action button, start inviting the users that you have set up previously to a specific division, or site, if that is what you want to do. Otherwise, your users all belong to your main account. So this primarily was done with a view for licensing. We're not entirely sure how relevant this would be for health product registrations. However, this is the structure, and that is why we request please one legal entity, one organizational account. Right. Sorry, this was just where you need to invite the user. Apology. Right. I think some of the examples just to reflect again. So as we can see here in the registration number screenshots, that's typically what a CIPC would look like. And sometimes we have had no information submitted, or information which we cannot tie to a specific legal entity or site specific. So the reason why we also anchored ourselves around CIPC, as I said, is because that is for us a unique identifier for a said legal entity, which then also holds the IP and the intellectual property for the products that's linked to it. And here you can see as well where we've got those multiple accounts. So as a result, because system is looking at the account and then finds multiple accounts with the same value, it just did not know which one to go and link the import for submission and sequence data to. And this is where we then need assistance from our applicants, please, to clean this up so that we can end up with one organization account, in order for us to actually rerun all of the imports. Right. Just the screenshot and the example of our user accounts, where we've got user accounts that were created. However, verification links were not clicked, and therefore accounts were not verified. So we can see a lot of these organizations where they were set up. So we've just grayed out this information. But basically, what the user type was, if it's an org admin or if it was a user, etc. Just when it was created, and then year, if it was actually verified. So as you can see here, where we don't have a verification date, we then need to go through the process of resending all of those links, and for the users then to hopefully action that user link and then verify their account so that they as well can be verified active account user. Until that step is completed, you will not be able to log on to the portal. Right, so I think just further to assistance that we ask for, please, from our applicants, is please to continue to use that portal.support@sahpra.org.za mailbox. I think just a kind reminder, please, in the subject, in order for us to then just prioritize, triage, and bucket the support requests, please do, for where we've got something that needs to go onto the issues log, please start your email with issue and then add the description of what the particular challenge is. If it's a suggestion for an enhancement or a feature, or even some update to our guideline, to granulate things a little bit more or enhance the guideline a little bit more so that we can elaborate, that's typically where we would request that you then indicate feature and then just a short description, and then give us the rest of the detail in the body of the mail. We're also adding a third level now that relates to master data. And again, here on the back of the request to update master data, it would be most helpful for us to then separate this from the issue email. And if we can categorize that as master data email, also a short description, and then we will publish for everybody a specific form that can be used. So it'll be a fillable electronic form that can be used to then just indicate by means of example. Section A will deal with SMF detail, section B will deal with APIMF detail, C will deal with dosage forms, etc., etc. And we will also allow on the form for a category called other, in case we have not catered for all of the reference lists where we have currently picked up challenges, issues, and those have been brought to our attention. We then ask that that gets submitted. And as I said, we will have a dedicated warm body on that to ensure that those updates and refreshes of the master data can get done quite a lot quicker than sitting in the queue either under issues or features. I must just note, please, that due to the influx of queries that we've seen where the account creation or specifically the guideline steps were not really complied with, we have had the support log, the support system quite severely bottlenecked. And as a result, it's taken quite a lot of time over last week and over the weekend just to try and triage these, bucket these, so that we can focus on addressing core system-related issues and separate out the ones that are user-driven, which we can give feedback on to you today and ask your assistance to then address that, so that those things, once they're sorted out, will enable us to deploy some of the other fixes and mitigations that really are linked to getting those initial things right. During the triaging process, I mean, when we have assessed this, after all of the queries were captured and we've got them codified, we have then specific main themes. And as those were grouped, once these get resolved, we will have 92% of our support tickets actually addressed. And we then can focus on individual issues which are unique in nature, and also then requires intervention. So just to share with you our initial thoughts and plan of action for the rest of the week. We've just broken this down into different activities across the different days for this week. As there are things that where we find ourselves, we are going to have to pause for a moment, reflect, and have a very structured approach around how we move forward, following our guidelines, following the different requirements, to also then address some of the bottlenecks that have slipped in. We would first ask, please, that applicants assist us with correcting then organizational and user data between this afternoon and tomorrow by 12. We are aiming to start a re-import of submission and sequence data after 12. But we can only do that and can only do that successfully if all of the accounts have been cleared, cleaned, and we then have a clean organizational account structure to re-import data against. We will do an assessment again after 12 to confirm that there are no further duplications and to confirm as well that we've now got complete data for CIPC and FTP. And if all looks green and it's a go, we will then start that re-import so that we can then do an assessment with our applicants come Wednesday morning. Once we've got those submissions in and they are matched to then a organizational account, we will then communicate with you guys on Wednesday afternoon's webinar between 2 and 4, that we ask then that you now start processing all of the legacy data applications by updating then those missing data fields and getting them ready to move from draft because they now have been completed and we've got complete metadata sets, they can then go and sit in your applications manager queue. And here again, we do allow for some time to process that through. Anything basically that is available or was available for you is to please continue working on that. You would note also on the portal, we did leave a little message just to say, please just continue to update your legacy data if it's available. And we want to continue that process also post the re-import so that at least that we have a fairly clean start Thursday at 12 for further follow-on activities. I do appreciate the fact that there may be a lot of old applications as we have started receiving some new ECTDs, but there's a lot of old applications where we have not received new ECTDs. So those e-submissions that still need to be processed, I think it's also important for us to understand what it is that applicants would be able to complete by Thursday. And which of these applications they may only process in due course, reminding and communicating them with everybody in the organization that if you cannot find an application in the application manager, please go to the draft section first, make sure that we've got all of the information, we populate it, we complete it, and it moves into the application manager view so that we can then process either renewal, variation, etc. So for the 8th and the 9th, we also would want to publish the variations coding table. And this will then include some of the biologicals variation codes that has been flagged that was not on the coding dropdown. It is basically an Excel matrix that we'll make available also on the SAHPRA website for easy reference. And also to receive further feedback on any other gaps that we may have. So we will publish that for our applicants to access on Wednesday, 12. Internally, we are running through that list again, just making sure that the relevant units have now provided all of their different variation codes and that we've got the right variation types and descriptions attached to each of those. As I've indicated, we will also publish the master data update request form for you by tomorrow morning at 10, so that we can then start receiving those very specific master data related tasks or support tickets through the support email address. Activities then largely from the 10th and through to the 11th, Thursday, Friday, is we want to then reopen new applications on Thursday morning at 8. We've got single accounts. We've got data that will run through, FTP details that have been updated. Because I think for by and large, the new applications that we received through Portal, we actually have not had any issues with those applications being submitted running through, bar the fact that we sometimes have had very old proof of payments that were uploaded where reference numbers and specifically the amounts did not match, and those ones were referred back. But where the application was submitted and the proof of payment was attached with the application order reference number and the right values, those have been passed along through to DocuBridge. All right. The second part of that also is then linked to the variations that can be submitted. Once we've completed that organizational data corrections and we have knocked off the re-import of sequence and submissions, we want to reopen on Friday morning variations applications workflow as well. But a lot of these reopening of variations workflow, does hinge on our ability to then complete the account correction, the re-import of data, and once that data has been re-imported, also just to move those applications from legacy draft, adding then the missing details, pushing them into the application manager view so that they are then active and they can be transacted against, whether for variation or renewal, etc. Or old e-submissions, where we require new baselines to come in the new ECTD format. We will, on Wednesday, during the webinar, do a very nice step-by-step run-through of how to submit those. After re-importing sequences post our account cleanup, we will then just ask that everybody checks that all of the applications and the sequences are then accounted for, and that we now don't have mismatches between multiple accounts, some sequences sitting here, some sequences sitting there. And this then to be completed between Thursday, Friday. And if there are still any gaps, to then continue to log those support requests on issues, and then with the description, missing sequence, etc. We will also, I think, just with regards to the baseline, the submission of baselines for moving from e-submission into ECTD, also just provide a updated document or a expanded user guide so that we can try and just granulate the steps a little bit more in terms of how to do this, what to do. And I think to the same token, withdrawals or cancellations, even with that, we currently have under the new 3.1 a specific submission type called withdrawal or cancellation, and that would be typically what you would need to access and submit to do the cancellation or withdrawal. But we will cover that in the document as well, so we can just guide you exactly to where that sits on the screen and exactly what information you would need to then populate to get that done. And then just the reminder to kind of just recap, please do just coordinate your internal workflows within the organization as to the account admin that then invites or may even also nominate a second account admin, and then the different users, as well as the structure that your organization wants to pursue. If for now we are comfortable to have the one organizational account, and later when we have licensing on portal, you want to create divisions, because as I said, it's more a consideration around management of licenses and then different SAHPRA licenses for different sites, etc. However, if we have more people in an organization, please, they just need to all reside then under one organization, even though you could have different sites or divisions set up as per your internal requirements. And just to ask, please, our different users not to go and create new organizational accounts. They belong to an account. They've been invited to create user details on that account, and they need to just complete that process and verify their details. Please also do not skip any of the portal steps, and as they say in Monopoly, go past start and collect 200 Rand, because unfortunately we do need to follow these logical sequential steps to get to a point where we can then upload that ECTD to FTP and release a trigger file. If we deposit those ECTDs and we don't complete the rest of the process, or we complete the upload and we also copy an old trigger file, that unfortunately does cause the FTP server storage space to fill up, and we unfortunately cannot do anything with those submissions because they will not move anywhere until the prompt actually comes through from the portal. DocuBridge specifically looks for that prompt, and it will only action those once it's received that successful prompt from the portal. Just a reminder, please please do make sure that our proof of payments that get uploaded shows in the correct payment reference number, and it also corresponds with the value that's on the order form. If there is a value that's not calculating correctly, raise that with us so that we could look at the fee calculation table. If there is an update or a correction that's required, we update, we correct, and we can then re-trigger the order form with the adjusted value. But it is very important for us to get that feedback and not just receive a proof of payment with another amount, as we will not be able to progress that beyond that point of disputing the payment and sending that back into the workflow. Also, just a kind reminder, please do stick with the naming convention for your submission folder as the application ID. Part of the reason why we need a lot of this information on the legacy applications is that the system reads your application number from the trigger file, which we create, which we pass along. So there's no need to have an application ID and within that another folder and another folder. We just want to make sure that the submission folder is called the application ID, and thereafter you just add your sequences and your information like you normally would. Right, I've noted the request, please not to upload any of the old manual trigger files anymore. Right, and I think also then just to anchor ourselves and reflect again on just the steps that we do need to walk through or follow to progress an application through Portal so that it can be successfully transmitted to the DocuBridge environment. So first thing first is for new applications that we then generate a new application ID. We then complete that application with all of the relevant particulars of the product. We, as a next step, need to then create a sequence. And at that stage, you will then have the opportunity to download the order form, which then, based on the detail of what we are trying to submit, so if it's a new application and it's for an NCE, this is the value as per the fee table, and therefore on the order form you will see first strength, so and so is the amount, or if there's a second and a third strength, then those are the aggregated amounts. And on that order form, we then have the payment reference number, we have the value that's payable, and we then ask that you download that order form, route it through your appropriate channels to ensure that the proof of payment is prepared. Your internal process dictates then that that may be something that happens once a week or twice a week or once every second week. But based on your internal process, once that payment has been done and you've received the proof of payment back, it goes two places. One needs to be included in the ECTD. And second is it needs to be uploaded to us on the portal so that it can go through that finance administrative verification process. Once from a finance admin perspective, we received something in the work queue that says payment submitted. We check those payments and we release them once a day. So if everything matches, payment reference number is there, amount is a match, we release those and have been doing that, and those applications then become available again for the applicant to then complete the upload to FTP. So you've prepped your dossier, you've got the new app ID, you've uploaded the proof of payment, and when we release back to you payments approved, you then proceed to this step where we basically upload via the FTP portal. You say confirm FTP. We then write that trigger file to DocuBridge. DocuBridge then starts running the validation so that we can validate the application through the automated like we do within DocuBridge. And then you will receive your response back from DocuBridge to say if the submission is then valid or if there's validation errors, in exactly the same way as we've had before. And then for all of those where the application is valid, it's passed the DocuBridge validation as well, it then just continues on the normal process. If it comes back and it's not valid, then we would ask please that you correct the deficiencies in the submission or add maybe any missing information. You will see that failed validation also enables the confirm upload button again, meaning once you've received that message from Automator and you have tweaked the submission, is to come back in on that transaction that's basically then still in a confirm FTP upload status, and then just confirm the FTP upload again once you're satisfied that the updated ECTD is ready, and then it will run through the same process. Right. I'll ask Cornel maybe just to remind us, just in terms of the guidelines, which guidelines we currently have. And as I said, we do invite feedback as to how to improve, granulate this a bit more. Certain things are not entirely clear. Give us that feedback. Let us try and enhance this. As I said, we remain committed to ensuring smooth user experience. And that also means that we can continue to improve on the guidances and the guidelines that we've put out. Cornel, anything that you want to add just on the training manuals or guidelines?
Nothing specifically, Christina. I'll share the link as well. Just going through the QA. I know we're going to open that up now. If there are any companies that registered only a single entity, if you wouldn't mind just sending us an email to the support address, just with, there was one example now where there's 3 different entities perfectly registered, different CIPC numbers. We can see that. Just with which one of those specifically, the company, the CIPC number, that'll help us to also then over the next day see, do the re-import and ensure individually that it's corrected. But I'll share the other link here on the chat.
Yeah. Okay. So please do just look out for that, so that we can then just have the guidelines accessible to everybody so that they can go through it. Sorry, just a second. Then from I think the guideline perspective, the note that I made, just to say that we will add the granulation around the baseline submissions. That'll then be something new that we add, that we then also give access to on Wednesday. And I think, colleagues, that kind of brings me to the end of just our feedback and the summary of where we are, what we've seen, some of the topics that we internally are focused on addressing, the timelines around when we expect these to be resolved, and obviously working throughout this week to try and get to a place with your assistance whereby Friday we are in a much healthier position. We have cleaner data, both at an organizational account level, as well as then matching your data sets with your accounts, so that they are accessible for you to actually carry on with the processing. I think from there, we anticipate that we will start getting some more good positive feedback around continuous refinement and correction of our master data reference lists. And it is, I think, for us as SAHPRA, where we stand at the moment, one of the challenges internally that we have is to say we are a regulatory authority that wants to, it's part of our mission and ambition to be a world-class regulatory authority, and that also means that we have to level up in terms of the systems that we have, in terms of the data that we have, cleaning data, standardizing data, normalizing data, and we rely on the feedback that you guys have been providing us, and hopefully will continue to provide us to get very good data records in place to support the business processes as we move forward from here. Before I open up for us to start dialogue, let me then just in closing say, we appreciate everybody's collaboration as we then continue to work together to strengthen the system's stability, but also to ensure much smoother operations for all moving forward. We will then reconvene with you on Wednesday and Friday to again carry forward the dialogue and continue to share information, continue to talk about some areas where we need to work together to address some of the key issues. Also keep sharing with you what the key themes are that's coming through the support logs, what the proposed resolutions are, and then the proposed activities and timelines that we have under those. We also then ask and encourage you to continue to support the process by clearing up our accounts section, making sure that our data is complete, and as we are then able to bring in legacy applications also to assist with remedying some of the legacy data gaps. It's critical for us by the end of the week to start getting to a point where we can focus on system issues and move beyond the point where we've got guideline or guidance non-compliant matters that actually congest our workflow queues and causes severe operational disruption for you, but also our ability, it impacts the resolution times. And the aim is to, by the end of the week, at least get to a place where we can again meet predictable service targets, and we can only do that with your assistance. Right. Cornel, I don't know if there's anything else you want to add from your side. Otherwise, what we can do in Tukoso is we can then just enable the mics. And I'm going to start going to the attendees list. And then we'll just try and take questions and cover as much feedback in the remaining hour as we can. I just want to ask if there is anything that you want to ask, please do also put that in the Q&A, right? If we run out of time, that at least we can revisit the Q&A and also bring some of those themes and topics in for discussion on Wednesday. So this is not a one-off. We definitely would want to continue to engage with you throughout the rest of the week and if needs be beyond that as well. Cornel, sorry, you wanted to add something?
Yes, Christina, just one thing to take note of which aligns with the timelines. The ability for API manufacturers that can't be found on the lookup between API, MEF, WHO, etc. We're aware of that, and I know there were some comments around we can't update until that's been resolved. So we're aware of that, and that aligns with our timeline to have that resolved by tomorrow to enable you to then also continue with updating your legacy data. So I saw a few questions around that. So that's noted, and it aligns with our communication and timeline plan.
Okay. Great stuff. Thanks, Cornel. So let me just stop sharing. If I can find the right button. There we go. Right. And I think then we can just move through now to our attendees log. Alrighty. Okay, so we can take hands, I think. And as I said, any questions that you've put in the chat that you actually want to ask now, please feel free to do so. And let's try and stay in that positive solutions mindset. It's really quite critical for us that we remain constructive in the feedback and finding a way forward to address some of the challenges. So first up, we have got Mohammed. And I will write the questions down, so please bear with me whilst I just multitask that. But Mohammed, please feel free to come in and just ask the question.
Okay, thank you, Christelle. In fact, I put my hand up earlier because we couldn't see the presentation. And we couldn't put it in the chat that we couldn't see the presentation. And it was, so I don't know if everybody's affected, but at least 2 people in our office, we couldn't see the presentation. So I don't know if it's possible to share that with us. That may help solving some of the problems. But for now, I mean, obviously the frustration levels are high, and I understand that we need to work through it. We haven't been able to submit anything to SAHPRA from the 18th of March. And also I'm worried about the turnaround time. So we've experienced problem on the 1st of April. We got the standard response that, in 2 days we'll have a response. We didn't get that. So I don't know, besides going through the webinars this week, I'm not sure if there would be another way to address problems in a quicker fashion. So that's just my comment for now. Thank you.
Thanks, Mohammed. Thanks for raising that. I think whilst we absolutely recognize the frustration, we do need to just highlight again some of the reasons why we are experiencing not such a smooth transition, and why we have got a constraint and bottleneck support log is because of the reason that I've underlined and explained in the presentation. And the way that we've then triaged those queries, as I said, we have looked at those very key themes that will help us address 92% of the problems quite rapidly if we just follow the systematic approach during the course of the week. Unfortunately, it's taken us a week's worth of incorrect transactions or incorrect use of account to get to this point. And it will also take a little bit of time for us to reverse out of this. And as I say, just with your assistance to fix the challenges that we've got. And unfortunately, we'll have to do this in a holistic or global approach, even though we know that some of the applicants were compliant and they were submitting their applications and creating their accounts correctly. We have to actually switch everything on at a time where we then are clean. Otherwise, we will continue to be chasing our tail. So I ask everybody please to bear with us. I think your frustration, equally on our side, it is shared, but we have outlined our plan of action, and we need to step through this systematically throughout the week. If I may take then the next hand from Alex.
Thanks, Christelle. My question relates to how you will handle the registration of academic institutions. So I manage a research unit at Stellenbosch University, and the university has, of course, several users of pharmaceutical products distributed amongst multiple environments. Universities don't have CIPC numbers. We have multiple practice numbers. How is that going to be handled? And then, sorry, a second question is just a bit unclear on how we withdraw existing profiles that we've registered and correct those to the correct category as you've outlined. Thank you.
Thank you, Alex. So I think one thing around the academic institutions, is it the institution that would need to create an account, or is it the individual with his or her respective practice number? Maybe just for clarity.
So I guess the question here is, we're a research facility that's non-profit. If we're going to be charged 400 Rand per application, I don't think that's justified. I think we should, as a state subsidized organization, I don't feel that would be appropriate. If there's a mechanism where that fee will be waived, then it would be fine for us to register under our unique practice number.
Okay. So yes, there is indeed an option for public institutions. we have accommodated for that specifically, as there is a number of public institutions that we do receive applications from at the moment. So if you want to reach out, Alex, that is also something that we can then just step you through. But it is also something that we've set up fairly recently for other colleagues at the National Department of Health. And the reason why then public institution is exactly for that reason. There is a different calculation structure that is triggered by that attributes. And indeed, then according to the fee guideline, that does get processed differently. So very happy to receive your correspondence on that, and we can then set up a discussion to just walk you through how to do that and how to link then the different individuals that is actually part of your research institution. But it's the research institution that will be created as a public entity, and we then just link your different users to that. So we can help you with that. Right. I think then our next question from, let me just see who's next. Sorry. Ongiwe Uniswa Siyaya.
Hi, Christelna, thank you so much. So I'm not sure if this was covered, but I did not see it on your slide. So my apologies if I've missed anything. My question pertains to the ability of this, like the system not allowing us to select more than one variation type at the stage where we select the variations. So it allows you to select one and then move on to the next stage where you will then classify the variation. My concern is that if the system does not allow for this functionality, the payment due for the variations to be submitted will be calculated incorrectly by the system because we would not have input all our changes.
Thank you, Bongiwe. So I think maybe then perhaps just a question from my side, just for further clarity. So we have in the ECTD 3.1 guideline, we've got variation types that gets submitted. So for argument's sake, type 1Bs, whether it be clinical quality or whatnot, they are submitted as type 1B. And then they are directed to either clinical or quality or inspectorate, whatever. And then within that submission, there would be 1 or 2 type 1Bs that is in a grouping. So our understanding on the structure and the way that we've defined it is type 1B, clinical. There is the ability to add 2 type 1B codes to work within the fee structure, allowing then for a grouping of 2 type 1Bs within the corresponding fee. And I think the same would apply to our type 2s and type 1A1INs. And this again, I just want to make sure that we stay consistent and we keep that thread from the ECTD 3.1, which also kicked in 1st of November. Did I understand your question right, or am I explaining it right?
I think maybe my question was not clear enough. So what I mean is, so when you get to that point where you have to select, like you were saying, type 1 clinical or type 2 quality and whatever. So there are instances where you would have, for example, a type 2 quality change, which will have multiple related changes associated with that change. And those changes are not necessarily always going to be type 2 quality. So it might be that you have a type 2 quality that has some type 1As or 1Bs associated with it that are submitted together in the same application because the changes are related to each other. So in that case, the system is not allowing us to select, for example, both a type 2 quality as well as a type 1A quality. So my concern is, how will payment then be calculated if I could work off the assumption that I'll select the highest rating, but then it will impact the invoice which is issued to me by the system.
That is correct, yes. So, I mean, for grouped variations, there's a specific option to submit a grouped variation. And it follows the logic of the 3-2-1. So 3 1As, 2 1B, 1 type 2 in a submission, in order for us to also manage the workflow and the service level around that. The fee, according to then the individual, even if it came in as an individual, 3-2-1. So how that structure runs for pricing, it will follow then each individual code based on the codification table and aggregate the total, so that we then have a fee for that group submission, which reflects the input and level of effort that is then required to complete that whole grouped submission. I'm not sure if you selected the option for group submission, or if you perhaps had selected maybe a type 2 and then try to add some of the other codes, because I think that probably might also be where you got stuck. But again, certainly something that we could try and even add extra step or two or slide or two in the guideline, and just add some screenshots to further clarify that.
Yeah, perhaps maybe this is something that I need to take offline with the portal support team, because we did not even have the option for selecting a grouped application that you mentioned. So I did not see that option at all.
Okay, so let me make a note of that. We will connect with you and we can then run through that process with you. I think probably you would be our litmus test to make sure that we have then explained that adequately, and at least if you're satisfied with the feedback, we can then, as I said, granulate the guideline and also share that with the rest of the colleagues in the Wednesday feedback session. I don't know if anybody else also has a question around that, but certainly happy to, once we've aligned, make sure that we publish that a little bit more broadly if anybody else is also getting stuck on that point.
All right, noted. Thank you so much, Christina.
Thank you. Right, and I think then next colleague, we've got Givemore.
Good afternoon, and thank you so much for the presentations. Mine is a quick one. I might have missed it. If there are missing sequences for an applicant, is there any action from our end, or there's still some importing that still needs to happen on your side?
Givemore, so I think what we've aligned on doing internally, and I'm not sure just from an organizational account perspective if you might have been or not might have been affected, but we will be rerunning the imports for all of the submissions and sequences that we have on DocuBridge. We will again run that into the engagement portal as a take-on activity. So I think as long as we were satisfied in January when those lists were originally shared out with Pratiba, that all of your submissions and sequences were accounted for. If you had provided feedback previously to say, we cannot pick up this sequence or that sequence, and we then completed that loop, all of the information that is in DocuBridge should then successfully transport with the re-import that we'll complete then by Wednesday. So on Wednesday, I would then kindly ask, when we have the webinar at 2:00, we will confirm with you re-imports have been completed. Please check if there are still any remaining gaps. And if so, to then notify us through that support email address so that we can then specifically deal with, on a case-by-case basis, organization, what application number and what sequences specifically. But again, we do rely on the fact that, we've done that verification in the earlier part of this year, and anything that was outstanding at that stage has then, in the meantime, been submitted through to SAHPRA for action. If it's in DocuBridge, we are definitely going to be reflecting that on the portal side. So I would suggest, please let us then complete the holistic mass fix for accounts, rerun the import once we've got that clean system thumbs up tomorrow by 12. And as I said, we'll be running that in Thursday afternoon, probably into Wednesday morning, and then can give everybody a clear indication on Wednesday to now go and do a last round of verification. We expect, if there is anything missing, to then just receive those tickets so that we can also have a very focused approach on dealing with these topics on a theme-by-theme basis. It will help us clear these things quite rapidly. So I hope that provides guidance on a way forward.
I think I get it. So we wait until the confirmation that a re-import has been done. And then we'll have to check thereafter if we are still missing something. I also had another different question. In the case we have responses that we need to submit to SAHPRA, of course, which are time bound, and we can't meet the deadline mainly because of the portal issues. Should we individually ask for extensions for those ones, or hopefully we can get this done this week?
Yeah, certainly. And I think, again, thank you for raising that. That's actually a really good question, and not something that we specifically called out in the feedback presentation slide. But considering just with where we are and the fact that we now have to pull up the handbrake and start a systematic approach to address some of these issues, I dare say almost revisit some of the steps that we should have had, step 1, 2, 3. We acknowledge the fact that you would not necessarily be able to submit any of the responses that's due. If anything was due last week, anything is due this week, we will be providing then an extension for those submissions. In fact, I think one of the topics that we just need to internally align with the core business colleagues on is that until we are comfortable that we've got really good system stability, we have the April window as a period of flex that will allow all of us to complete the necessary activities and just make sure that we've got all systems green, running smoothly, and that we provide that enabling environment for you to actually log on, submit your response, and run through the process without any further hiccups. So I hope that provides you, as well as some of the other colleagues that may have that concern, with some reassurance, is that I think, it would be really foolhardy of us to say no. If the response is due today, then it must come in today. We just have to be realistic and pragmatic around where we find ourselves, and then agree a good way forward to address this. So if by Friday we have a green light on switching workflow processes back on, you may start submitting your responses if they are due. And we will just keep communicating with you, but we have this month of April to stabilize system and then have a period of flex in terms of if we've missed a deadline, that we have the remainder of April just to get those ones in and complete. And that is then something that we have alignment with core units on. Thanks, Gibmore.
Thank you. That's all for me.
Great stuff. Then I think our next person on the list is Nokutula.
Hi, Christelna. Hi, Christelna. Hi, Christelna.
Hi, Nokutula.
Hi. Thank you. My question is with regards to the tabs on the portal. So when all the other users log in, they do not have all the tabs, such as they only have application and draft. That's it. And approved, obviously. But then there's no I'll tell you what else they don't have. They don't have the legacy application tab. They don't have the search application tab. So I just need to know, why is that? Is it because maybe the developers are still uploading that? Yeah.
Nokutula, yeah, that is a bit of a strange one. Because if the users are, well, basically seeing what you're seeing, meaning we've got one one organization account, and the users are logging onto that same organization account that you are on, they should typically have a similar view based, of course, on their roles and their permissions, who's an org admin and who's a user, but they should be looking at the same things you are. So I think maybe from my side, what I can do is just ask one of the team in the support desk to actually reach out to you, and we can perhaps just get online. We can share screens, and then just try and unpack that. That does sound quite strange. It's not something that we have seen on the support log. I know that we had some challenges with colleagues that were using Microsoft Edge instead of Google Chrome, but this seems a little bit odd. So happy to get one of the team to reach out to you, and we can tackle that one and just get everybody looking at the same thing under the same organization, and then just seeing the different options. So I've made a note of that. Thank you.
Oh, okay. No, thank you so much. I just have another quick one. There's an application that we worked on, I think it was last week, Wednesday, Thursday, thereabout. It was a pre-reg response. And then it said the payment was
Sorry,
pending.
Menyan, I don't know where to log this. Oh, you'd log the ticket. Okay.
Yes, sir.
Okay.
Sorry, Nokutula, carry on.
All right. So we created the response, and then we got the order. Well, we didn't get the order. We just got the status that pending payment. So when we went there following day, it had completely disappeared. So there was not even the status that it's awaiting payment. So I do see that now there is a status that we should not do any HPA applications, which I don't know whether a pre-reg response will also be classified as an HPA applications, or by HPA applications, you only mean new submissions. So yeah, not too sure again why that happened.
Products in this application.
Yeah. Look, yeah, so I would ask maybe if you can just, well, if you have a screen grab of that application ID, or you've written that down somewhere, if you can share that with me directly so we can have a look at that. I'm not sure if this is linked to the other issue where we may have a user that's created something, and there is a disconnect between the user and the organization. As a result, it's living somewhere in cyberspace, but we need to bring those wires back together again, and just make sure everything is sitting in the same environment. If you could screen share or send me any details that you may have on this, but just email me directly so I can work with the support team, and we can just unpack, because I almost suspect that it has something to do with the other issue that you've just described. But yeah, certainly happy to unpack that with you and troubleshoot it. Right. Thanks, Nokutula. And then I think just going on to the next question from James.
Thanks, Christiana, and thanks for the webinar. My question revolves around if you've got multiple organizations, which I didn't create, and I don't know what the passwords are for those organizations. How can I check them? Or do I just send you under support the CIPC number that I want, and then yeah, the real question is, how do I check which we want and which is the actual one, and how do we go about it from a practical point of view?
Yeah, Graham, thanks for that question. And I mean, I think we're sitting with a similar conundrum as you are. We do have a list. Basically, we've done an export of all of the user accounts, and we can see where either an organization was created maybe with the same naming convention multiple times, or when the same CIPC number is used multiple times. And for you, we are happy to just have a look at your organization's logs. I think we may have already cleaned up your organization, but let me just confirm with the support team. I think we were able to suss out which is the one that actually had a CIPC number, and the other ones we may have dropped off already, but I can definitely check that with you and just pop you a mail, and then we can flag any other ones that must come off, and just help you add the other guys to the main account.
Thanks so much. Really appreciate it. Thank you.
All right, no problem. Thank you. Then we have got Larita.
Christina, thank you very much. I have a few questions which have popped into the Q&A, but I just want to focus on one, which is our most critical one. We received queries on the 18th when the admin freeze started, and the response was due on the 1st when the portal launched. So when I logged in, we do have the application there, but it already had 2 sequence 2s. So sequence 0002, there was a duplicate listed there already. So I wanted to create a follow-up sequence for the response. And when I created a sequence, it created another sequence 2. So currently we are sitting with 3 sequence 2s. And when I wanted to create another one, it created sequence 3. However, for the last sequence 2 and the sequence 3, it created orders. So the 2 issues that we are sitting with, we have duplicate sequences, which we did not create. It was imported, of course, with the application. And now with the correct numbering of the sequence, which we need to create for the response, has an order with a large amount, which is incorrect for a response. So in this instance, is it applicant specific? I have sent an email as well for the support team, or is it a general issue experienced, and what should we do?
Larita, yeah, so I have seen your query. We did capture that on the log, so I think I know which one you're talking about. We've seen the screenshot. So unfortunately, and I suppose this is now negatively impacted, everybody across the board, with the imports, and the issues where we've had matching the sequences and having to re-import again. We may have had some duplications in that data sets. So we are going to be taking out the incorrect information, and then, as I said, be re-importing based on the updated DocuBridge list. So that should reset then to the correct number of sequences matching and corresponding then with what is in DocuBridge. And if you then log on and you expect to see sequence 2, then that's what you should be seeing. Yeah, I think probably what I can do is, once we've completed that exercise, let us then revert back to you on the ticket that you've logged, and share with you the screen grab of where we are, what it looks like once re-import's finished, and we can then align with you on what the next step is to actually then progress that submission. So again, also just to the point that you've raised where your response was due on the 1st, please also then just for you, this applies that we obviously need to sort out these collective issues before we take those responses in, and therefore that timeline for getting all of this through before end of April would then also extend to you. So yeah, let us work on your support ticket, and then once re-imports is done, we can actually engage with you, and hopefully that would have resolved the issue. Right.
Thanks, Christina. I just, sorry, can I just highlight another point? Okay, thank you. And I'm sure that will then also resolve the order that is related to those sequences.
Yes.
Just a different point I wanted to ask is under product information on our screen, we can, under ATC, the APIs are listed and we can only select one. So in an instance where a product contains more than one API, what is to be done? Because under API manufacturer information, surely more than one API can be added, but under ATC, it lists APIs on the screen that I can view.
Larita, thanks also for that question. So what I mentioned around the ATC level 5, so that details around ATC or pharmacological classification, we have the ATC level 5 that is showing at the moment. And that's not the level that we want to display for selection. So yes, where you actually need to add all of the APIs is on the API section of the product information. So there, if you've got 2 or 3 or 4 APIs to assist us with the calculation based on the gazetted fee structure, where we've got API 1 and 2 as part of your base cost. And then for every additional API after that, there is then a specific surcharge. We have APIs where there's multiple APIs, and it's structured and captured in that way, so that, again, system can help us to calculate when a surcharge is due and when it is not applicable. So this is typically where we would have then the multiple APIs populated. On the ATC section, we will be correcting that, so it actually points to ATC level 2. And the reason why we've introduced the information that is now captured for ATC is so that over time we can also create a structure as we look at the pharmacological classifications that's currently captured in our guidelines, again with a mindset of continuous improvement and standardization and harmonization. We do want to transition and adopt ATC, but we have to make sure that we start building enough data in order for us to then complete a very detailed mapping exercise to assist us with such a transition. So ATC level 2 is what we will have displayed. So there, indeed, we do not want you to add the APIs. We actually want you to reflect the ATC level 2 so that we can then cross-map that over time as we build more data to what the pharmacological classification is that we would typically capture and reference as per the SAHPRA context. So yeah, apologies for causing that confusion. That from our side, we did pick that up once the support tickets started to come in, and we will be correcting that. Great. And then I can move through to next question from Connie. Just calling out, it's 1:45, so we've got about 15 minutes to go. Anything that we can't get through, please, as I said, do remember just to pop those in the Q&A. We will go through that and also try and address some themes and topics in the next engagement. Thanks. Connie.
Thanks, Christina. Mine is a quick one. In cases where the applicant before the freeze had applied and had the link, and they were able to verify with the email for the account, and they could even get into the portal. And then after the freeze, they are now no longer being able to get into the portal. And we had sent an email to, and were told 48 hours. And now I wanted to just understand, how do we now correct? Because surely before, for us to have access the portal means there was no mistake with our CIPC and stuff. So how do we make sure that our account is active? Thanks.
Funny, yeah. So I think in terms of the account being created, if the account was created and the admin user and the relevant invited users were confirmed and verified, as I've indicated, we can see on our systems log, who verified, when emails were sent through, when those emails were opened, who then confirmed, who verified. So if you indicate that you have logged a support desk ticket for that, we will then find that information and just share with you what we can see on our side, and then just propose a way for us to correct access issues if there is anything we can do to unclog that drain for you there. I just want to please do refresh my mind. I've got the support log currently grouped by organization. Which organization are you inquiring on behalf of?
Bliss Pharmaceuticals.
Bliss Pharmaceuticals. Okay, 100%. Let us have a look at that ticket for you and just see if there's anything that we can resolve from our side, access-wise. And we can then just revert to you on email until we get that cleared out.
Thank you.
Thank you. And then I think we've got a question from Bruce. Hi, Bruce.
There we go. Sorry, I was just muted there. So thank you. I'm Bruce. I'm from the nuclear medicine space. So we are most of our work is with the radio pharmaceuticals and from the various radio pharmacies, of which 90% of those products are under Section 21. So that is the bulk of our work. Generally, how it's worked historically, so prior to the launch of this portal, was that we would make a bulk application on one of the specific products, and that would last 6 months on that application. So that application was made, obviously, a single application for 400 Rand, and it was without any patient details because we're using diagnostic materials, not therapeutics in this case. So it's diagnostics. We don't know the patient's name, and there's no ability to know who we are requesting that product for at the time that we request it. And obviously, we provide a service where we order the day before for patients. And this portal here, so I guess the first question I have is it possible to make applications under this circumstance when we don't actually know the patient's name? It seems to be a slightly different paradigm to perhaps some of the other pharmacy questions that are coming up now. Diagnostics versus therapeutics in this case.
Bruce, yeah, so I mean, I'm not the subject matter expert on that per se, and I'm not sure if Dr. Shamli is online, but what I can maybe just offer in terms of some insight or some guidance is that for the multiple patients or then larger quantities, I think part of the challenges that we've been having and where we've seen some concerns being raised from a governance and oversight perspective is just reconciling and closing the process with when it comes to unregistered products within the country. And there has been some enhancements that we've introduced in that workflow so that even though we have the mechanism where you can then apply in anticipation for a quantity of X, we acknowledge and we're mindful of the fact that those quantities that's being applied for is based on a retrospective view of whatever the consumption was over a period of time, and therefore a informed estimate is made around, what you might need for the next 6 months. So within the confines of that is to allow then an application for that projected quantity to be made, but very, very critical for us to then also at the back end of that close then the loop once these products have been dispensed for treatment or diagnosis for patient person XYZ, by receiving back then those outcome reports or progress reports and whatever quantity was then prescribed, used for treatment or diagnosis, so that we are able to reconcile what was originally approved against what was then consumed and what is the word? Account. There we go. Account for the quantity of unregistered product that was brought in that was actually used. So there are some governance considerations.
Are you thinking that, all of these are locally produced products. None of them are, some are very few are imported, but they're all local suppliers. So not imported product. This is a locally produced radiopharmaceutical.
Then I will have to defer to Shamli. Actually, as I said, I'm not really a subject matter expert, but I think by and large that is typically how we would deal with Section 21 large application format for something that gets imported. So yeah,
okay. So in the case that this is not imported, this is
100%. Let me just check if Dr. Shamli is online. Otherwise, that might be something that I could advise her to have a separate discussion with you, because your situation seems, as you said, quite
well, it's
unique
actually quite catastrophic, this new portal for us. If it gets put through in the case, in the way it functions now, obviously it will shut down just the provision of hundreds of diagnostic studies a day around the country. So it's really something, and the current setup of the portal, just working through, doesn't seem to allow for our specific sort of use case in nuclear medicine, PET-CT, radio pharmacy. So it's a big worry, and I don't you don't know the subject maybe with the depth that you would like to, but does the portal, to close the loop, as you say, does the portal allow for that with a bulk application, no patient name, and then a subsequent registration or linking of a product to a patient so that you can account for it and follow it up?
Yes, it does.
So you can make the application without a patient name linked to it?
That's correct, yes.
Okay, is that okay? I can't figure my way around the portal on that.
Okay,
on that
front.
Yeah.
But Bruce, that's not a problem. I think understanding just what's underpinning your concern, it does sound like we can step that through with you and just show you exactly how it works and what is required at the onset in terms of just getting the bulk information in. So, provisionally how many pack sizes or units you would want to apply for, and then subsequent within the 6 months after authorization has been issued, just afterwards coming to revisit and then just adding those outcome reports or progress reports or patient details, if you will, as a after the fact event. I will also just share with you again the guideline for Section 21 for that multiple patient application scenario. And then we can just set up a Teams meeting with you, so we can step that through and just show you very nicely how that works and what's required now versus what can be updated at a later stage. We will try and do that actually tomorrow morning, just considering the urgency around this.
I would really appreciate that. Thank you.
Certainly.
How will you be in contact? Will you be in contact with me directly, or?
Yes. Well, actually, how can I say? Can you maybe just put your contact number where I can get a hold of you directly and your email address on the Q&A for me? Or otherwise, if you want to just email me directly, I can then set up the Teams link and just phone you to confirm what time we want to reconvene and then just run this through with you.
Okay, I'm going to put my details in the chat. So that,
yeah, you are welcome to WhatsApp me as well. My number is on the SAHPRA website. I will just for reference purposes also just put that in the Q&A so it's easy to access. But thanks. I will pick up your details from there and then we can just set up a chat.
Thank you. I'd appreciate that.
Okay. Right. So, colleagues, I think seeing as we're almost at the top of the hour, I will take one last question from Michelle. And I am going to ask, please, all of the other colleagues that we still have in the queue, please just make sure we've got your question in the Q&A section. We counted for that so that we can come back to you. And I think also, I want to kind of just come back to you guys in sequence of this order. Let me just see if I can actually do a screen grab, so that I just start from the top when we come back on Wednesday. And all right, okay, and just start calling out everybody that we didn't manage to talk to today. All righty. So Michelle, let us take your question, and then we will probably have to rush to just close the session off. I know there's a few colleagues that have got a 4 o'clock commitment. Michelle, over to you.
Thank you, Christina. My worry is resubmissions. After we've done a baseline submission, we're doing resubmissions probably because we've got an RTQ or we've got an e-submission that is still under review. There's not many of those.
Michelle, I'm so sorry. I had a signal glitch for a moment there. May you just start your question again? I lost you there for a few seconds.
Sure. My worry is when we do baselines and we have a resubmission, either because we've got an RTQ or our e-submission before the first freeze is still under review. We do the baseline, we do our resubmission. If the payment is going to reject our resubmission, is there any way that we can add a code that says resubmission?
Oh, that's a weird one. So I think currently
on the going to be rejected.
So I mean, how would this have worked within ECTD 3.1? What would be the submission type that you would typically have used?
I would have used the submission of the previous, of the one that we are resubmitting, for example, 1B23A. But most of them are type 2s, I must admit. And we would put the old payment in, which happened long before the April freeze. But we have to resubmit it because it's unapproved data. But then if the payment guide is going to kick us out because we used the old guideline.
Yeah. Because I mean, obviously, from a financial transaction perspective, being subject to AG review, when the transaction is initiated, usually is the pricing that's prevalent at that particular point in time. So that probably could pose a problem. And I think we've seen that also with some of the older proof of payments that were attached. But when you talk about additional information that needs to be submitted as part of your original submission, it sounds like we're trying to submit a follow-on sequence to the original submission for additional data. That's kind of like how I'm getting it, and I'm not sure if I'm interpreting that right, but for that, there is then under that same submission the option to create then this additional sequence, but select then additional data, if that is what we are trying to do.
No, we're not adding any data. We're just resubmitting the sequence because it's not in the baseline, because it's unapproved information. Because we need to, the very next, for example, the first sequence is the baseline. The next one is the resubmission. And then the next one is our RTQ. But we have to submit it because we want it to become part of the registered detail. So, we're not adding any data there. The next sequence would be our response.
But should we not be then withdrawing the original ESOP? Well, actually, you know what? Let me maybe put Pratibha in contact with you. This sounds kind of like a little bit counter the 3.1 workflow. I think best that we unpack this with you. If we are actually, if we're dealing with an unapproved or unregistered product, that certainly makes this a little bit more of a complicated discussion, something that we probably would need to deal with you directly on and just make sure that we follow the right process and it meets then the guidelines and the formats that we can accommodate for within 3.1 or via the portal for that matter. Michelle, again, just your organization as well, please, so that we can get the people to connect with you.
GlaxoSmithKline.
Okay. 100%. Michelle, I will ask Pratibha to just connect with you at GlaxoSmithKline so we can sort that one out.
Thank you. Because it should be a note payment, if you know what I'm trying to say, because it's
Yeah.
Yeah, it's already reviewed and we've received our first questions.
No, 100%. I hear what you're saying, and it makes sense. I think we just have to make sure that we take it in the right way so that it doesn't attract then a surcharge. Well noted.
Right. Yeah, thank you.
Right. Thanks very much. Colleagues, then unfortunately we have come to the top of the hour. Actually, we've gone a little bit over. I am gonna ask, please, that we just close off today's session. Please do respond and accept the invitations for Wednesday and Friday sessions, so that we may then reconvene and continue to feed back to you. We will also be taking the Q&A and unpacking that in conjunction with the support log. And we will share this presentation so that you've got access to what we were doing or what we are proposing to do on which days, and also how you can support the process and support us to make sure that we get system stability. For our aim is definitely to have the system stable by Friday, but we would need your support on that. So again, just thank you very much for coming to the session and also engaging in a positive mindset. I appreciate the fact that we were able to have this conversation and we can unpack the possible solutions with you. And yeah, we will look forward to engaging with you again on Wednesday. And the folks that we need to connect with on some of the urgent topics, we'll start reaching out and setting up those discussion sessions with you tomorrow. Thank you very much, everyone. Thanks. Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.